Hypovolemic shock can be divided into 4 classes: Class 1, Class 2, Class 3, and Class 4. It is also can be divided into mild, moderate, severe, and dying. First, it depends on the percentage of the blood loss. For the Class 1, the blood loss will be less than 15%. Meanwhile, for the Class 2, the blood loss will be 15 to 30. Meanwhile, for the Class 3, it will be 30 to 40, and Class 4, which is more than 40%. And if converted into milliliter, for the Class 1, it will be less than 750 milliliter. For the Class 2, 750 milliliter until 1.5 liter. For the Class 3, the blood loss will be 1.5 until 2 liter, and for the Class 4 will more than 2 liter. And then the classification divided by the mental state, pallor, blood pressure, heart rate, respiratory rate, urine out and urine output. For the Class 1, all will be normal, but difference with the Class 2, Class 3, and Class 4. For the mental state, for the Class 1, it will be alert, and for the Class 2, the patient will be anxious, and the Class 3, the patients will be confused and drowsy, and Class 4, which is dying class, which the patient will comatose and or drowsy. And for the Class 2, 3, and 4, there will be presence of the conjunctival pallor. And for the blood pressure, it will be reduced for the Class 2, Class 3, and Class 4. This is due to the reduce of the cardiac output, and the systolic blood pressure for the Class 2 will be normal, Class 3 will be low, and Class 4 will be very low. For the diastolic blood pressure for the Class 2 will be high, and for the Class 3 will be low, and Class 4 it will unobtainable. Moving on to the heart rate. For the Class 2, the heart rate will be 100 until 120. For Class 3, the heart rate is more than 120, and Class 4 will be more than 140. For the Class 1, the normal heart rate will be 60 until 100. Moving on to respiratory rate. The respiratory rate will be high for the Class 2, Class 3, and Class 4. This is due to the compensation of the body due to the reduce of the oxygen. Moving on to the urine output. The urine output for the Class 2 is near normal, and Class 3 oliguria, and Class 4 anuria. This is happened due to the renal hypoperfusion. That's all. Thank you.